I'm Kenneth Rockwood. I'm professor of geriatric medicine and neurology at Dalhousie University, and I'm a geriatrician and internist at the QE2. I also am privileged to hold the Dalhousie Medical Research Foundation Catherine Allen Weldon Chair in Alzheimer Research. My work on frailty has focused on a couple of questions, but the work that's recognized the best is the work that underpins how to measure frailty, because you can't manage what you don't measure. So we've developed two techniques. One is a very mathematically based, sophisticated data-driven technique about what makes people frail. And the other is what happens to people when they become frail is that they typically are at risk to fail in certain things. They can't think as well anymore. Their function is not as good. Their balance not quite as good. They often walk more slowly. They often have a constricted circle of friends. And what we've done with something called the clinical frailty scale is we've organized all of that information into the most common patterns by which those things go awry. It's really important to study frailty in relation to COVID-19. Anytime you have an illness that affects older people, it will always be the case that frailty is important, because frailty is all about the differential response to an insult. And a really exciting thing we found out here, and a bit contrary to our expectation, was that frailty is predisposing everybody, but is not predisposing everybody to the same extent. So what I did at Northwood was a couple of things. I was there with Health Authority, and I was also there separately with Lisa Barrett and Sam Cyril. And Lisa has a project in which she's aiming to characterize at the level of the response of the body and the characteristics of the virus. And so an important question scientifically now is, how is it that some people who are exposed are able to hold the illness at its mildest stage and not progress too severe and then to critical disease? The work that we're doing, I think, will be helpful not just for the second wave of the pandemic, which by most calculations seems pretty much inevitable, but for other respiratory illness. One of the things that's really important out of this, though, is it looks like the impact of scrupulous hand washing and not touching your face and wearing a mask is the number of people who will develop respiratory illness will go down. So it may be that we'll have a strategy that will emphasize this just for seasonal influenza. And what the research that we're doing right now will help us understand is there something in particular in terms of the immune response of the individuals or of the nature of the influenza illness that will give us a way to approach what treatments for this might be. So a huge emphasis is on vaccination, and that's important, but it may well be that you'll have treatments that will help us to moderate the impact of the pandemic illness.